Bladder cancer is a medical condition in which abnormal cells multiply uncontrollably in the bladder, the organ in your pelvis that holds urine. Early symptoms can include blood in the urine, which may be painless, the increased urge to urinate, and pain during urination. As the disease progresses, one may experience lower back pain, loss of appetite and weight, and swelling in the feet. Treatment options vary based on the stage and grade of the cancer, but can include surgery, chemotherapy, radiation, or immunotherapy. Risk factors for developing bladder cancer include smoking, exposure to certain chemicals, chronic bladder inflammation, and a family history of the disease. Here's a closer look at the detailed aspects of bladder cancer, unveiling its complexities and impact on individuals' health. Symptoms and progression of bladder cancer. Bladder cancer often begins with the appearance of certain symptoms that prompt individuals to seek medical attention. Hematuria, or blood in the urine, is the most common and frequently the earliest sign, a symptom that should never be ignored as it can be indicative of multiple disorders. As the disease progresses, patients may experience increased urgency or frequency of urination, pain during urination, dysuria, and lower back pain. Advanced bladder cancer can lead to more severe symptoms such as pelvic pain, weight loss, and swelling in the lower extremities. Understanding these symptoms and their progression is crucial because early detection of bladder cancer dramatically improves the chances of successful treatment and can potentially halt the disease's advancement to more critical stages. Diagnosis of bladder cancer. Diagnosis of bladder cancer often requires a multifaceted approach, as the disease can present with nonspecific symptoms such as hematuria, blood in urine, which is also common in benign conditions. The most definitive diagnostic modality is cystoscopy, wherein a urologist visually examines the bladder lining using a scope inserted through the urethra. Urine cytology can complement this procedure by detecting cancerous cells shed into the urine, albeit with variable sensitivity. Imaging studies, including CT urography, MRI, and ultrasound, help assess the extent of the cancer and inspect for metastasis. Tumor markers and genetic tests are evolving tools that promise to enhance early detection. Accurate and timely diagnosis is crucial, as the prognosis of bladder cancer is closely linked to the stage at which it is identified. Cause and risk factor of bladder cancer. Bladder cancer primarily stems from changes in bladder cells' DNA. These alterations trigger abnormal cell growth and division, leading to the development of a tumor. Risk factors amplifying susceptibility include smoking, which can multiply the danger due to harmful chemicals concentrating in urine. Occupational exposure to chemicals used in manufacturing dyes, rubber, leather, textiles, and paint products also heightens risks. Chronic bladder inflammation or irritation, prior cancer treatment, especially with drugs like cyclophosphamide or radiation near the pelvic area, can contribute. Age, race, and a family history of the disease also play a role, with older individuals, Caucasians, and those with genetic predispositions facing higher incidence rates. Treatment and management of bladder cancer. Effective treatment of bladder cancer often hinges on the disease's stage and grade. Non-invasive cancers can often be managed with transurethral resection, or BT, possibly followed by intravesical therapy, where agents like Bacillus calmette-guerin, BCG, are instilled directly into the bladder to prevent recurrence. Muscle-invasive cancers may require more aggressive approaches, including radical cystectomy, which involves the removal of the entire bladder and surrounding lymph nodes. Advances in surgical techniques have enabled bladder-preserving strategies when appropriate. Chemotherapy, radiation therapy, and immunotherapy also play critical roles, with emerging targeted therapies and PD-L1 inhibitors offering new hope for improved outcomes, particularly in metastatic cases. Multidisciplinary care is vital, encompassing urologists, oncologists, radiologists, and pathologists to tailor a personalized treatment plan for optimal patient outcomes.